Welcome to DevOps Accents, a podcast on everything around DevOps, public cloud, and cloud-native topics, with your hosts, Pablo, Leo, and Kirill.
Hello and welcome into another episode of DevOps Accents, a podcast where we, the co-founders of MKDev, get together to discuss all things around DevOps, cloud-native technologies, AI, data, and anything that happens around MKDev and in our industry that gets into our attention, and we just discuss everything. Before we move into another episode and meet our new guest, let me take some time to let you know new things that happened around here. You probably saw that new videos on Cloud Run by Pablo. Go check them now. It's very useful for you to, especially if you are looking into cost reduction, and Google might be very greedy on that. And go there and check. You can drop your costs by whopping 87%. Learn how to do that from the videos, and also personally recommend a very cool video on how to process thousands of images using AI and creating the description for them. This is something that we did for our own website. Kirill did tremendous work, and huge amount of work was done, and I cannot imagine this doing without AI, and go and learn how it worked. Basically, this is a video version of our article on the website. If you prefer videos, if you do not like reading, this is your format. Go and check this now. And don't forget to subscribe to our YouTube channel, because this is where some the most interesting things happen, including our podcast. And you don't want to miss that, because today we have our very esteemed guest, Sergiej Soft. Hi, Sergiej.
Hi, guys.
So, Sergiej is a very seasoned DevOps engineer and CTO and startup owner and entrepreneur, currently working on Caspar Health, a health tech company. So, Sergiej, my first questions to you, as usual, on our DevOps Accents podcast. What is your accent?
Yeah, my accent. So I actually came into tech out of incident, so to say. When I moved to Germany, it was like 15, 16 years ago. I could not have, and I back then I didn't speak German. Back then we needed to have like this permission to work, and it was extremely hard to find myself with a family and basically be adopted. So I decided to start my own startup. That's the easiest way if you can't get employed properly. And with limited budget bootstrapping, you can't afford having your own tech team. So you learn on things basically step by step, and that's how I progressed from being a solo business founder into a founder / a CTO, and this is how it started.
Cool.
And just like a small, the kind of a correction, I'm not a DevOps. I am working with a wonderful, dedicated, and talented DevOps team, but myself, I like it just to work alongside with them.
If you work with a DevOps team, how do you call yourself, if not over DevOps?
Yeah, my current title is Head of Technology, which entitles pretty much everything that tech leaders do, and depends on the company size. It might be a CTO or VP of engineering, but my day-to-day responsibility is not running pipelines or optimizing containers. It's making sure that overall, holistically, the technology goes in the direction that we foresee this in the business plans.
Mm-hmm. Guys, Pablo, Kirill, you as the DevOps guys, where do you draw the line between DevOps, operations, development, and everything else? What is because for me, DevOps is more like a short term describing anything that is cloud related. Am I wrong?
DevOps is still tightly coupled with the platform engineering and infrastructure, whereas someone like head of technology is responsible also for technology in product teams and basically everything, and not just the part related to pipelines, infrastructure, containers, and the cloud architecture.
It's interesting how we apply the word ops to anything that is, stays super important for like a foundational layer. Like right now, there is this ML ops. We coined DevOps. Like before that, we didn't have that term. So the ops seems to be, the jobs to get done in order to underlying infrastructure to function. And it's not like necessarily cloud infrastructure, but general infrastructure.
There is even BizOps and FinOps. I think it's just someone went too far at some point and started attaching ops to any word. So you can see like vacancies for BizOps, and then it's really hard to understand what this case means.
Ops is a new job.
There's business operations as completely unrelated to infrastructure and technology. But then there's also BizOps terms that has something to do with DevOps. It's confusing.
But answering your question, Leo, I think there is, in every company, you will have a different boundaries for that line. Like, how do you define a DevOps, ML ops? Because like this resonates back when I was working at a blockchain company, and we constantly were hiring for DevOps. And I was like, at some point, like, why do we keep the pipeline always open while engineers are already kind of like, we've closed it several times. Back then, my CTO says, because the whole blockchain is DevOps. This is how he defined that back then.
Okay, but how did you end up in health stack? Like you started. Just give us a description of your career for those who wonders, because we have many among our followers and among our readers and visitors, we have people from all the different domains, and many of them are interested in how to build, how to continue their career. And like you've been in a blockchain, now you're in a health stack company. That's a big of, I don't know, a stretch from one to another. Like, how did you make this leap?
Yeah, I think it's you have different type of personalities, and I belong to that kind of people that always pick to build a startup or a business, or join a startup or a business that relates to their own problem. I think blockchain was the type where I was really curious about generally the world of finance, different libertarian movements, about the so-called Austrian School of Economics, where you question the status quo of the existing system, financial system, and try to turn it in your favor or try to apply this into your favor. Right now, health is something that I'm really bullish, and I really believe that health hasn't been evolving in pair with technology for the last 20 years, and there are a massive gaps to catch up. And I believe technology that is available should really kind of like push these boundaries forward in health tech. And my wife is making fun of me. She says like, Sergey, you're always building a startup like period of your life. Like before I was building Freeletics, it's the biggest fitness app in EU, or a question is probably in the world. Like we had like 54 million users, because I wanted to build daily healthy habits. And once I've reached that daily healthy habits, I started to think, okay, my mission is over. Now, after 40, you suddenly realize that you are mortal. So you think about, okay, I need to invest in health because I want to keep it longer. So probably in 5 years or 10 years, it's going to be something with elderly care, and then you name it.
So it was like a deliberate choice rather than you were sitting there thinking, who might hire me. You were looking for an opportunity there, and you seized it.
Yeah, I'm curious to answer you, like, or actually ask you, how do you do that? Because there is either a leap of technology that you chase, and you learn a new technology because you're really driven to push the boundaries of technology. So if there, like, I see people that always jumping on the newest topic or the newest bandwagon. The other ones, like me, I'm not really like that technology driven. I'm more look at society and problems that burning, and try to leverage technology to solve those problems. And I'm curious how to see where are you with these questions. How do you jump and become professionals in DevOps field?
Okay, guys, that's probably the question for you. Kirill, you start.
I mean, in terms of if I explain how I choose the projects on which I work historically, okay, like at some point there is no luxury of choosing, right? Because when you enter the profession, you're just searching for a job. So there is not like, I want to work for this sector. It's more like, I want to work. But at some point for me, it transformed because for me, DevOps and infrastructure work is all about acceleration and making companies like run faster, shipping stuff faster without compromising on security and without like spending too much money. And for me, the most exciting part is always to work in the companies that are not purely technology companies, but that will benefit from this kind of change. Because on one side, I think also, for example, for us as a DevOps and cloud consultancy, some purely technology company like, let's say, Netflix probably is not interested in our services, but at the same time, there is not much we can offer to them. But if you take some like a government sector, there is so much work to do, and for me, it's exciting to work in these areas just because there is so many opportunities to improve this, or something like rail logistics or logistics in general. So that's how I approach things currently. That's for me, it's really interesting to bring cloud and DevOps and all the related topics to industries that are usually not known for being digital or leveraging all of this stack, and helping them to improve or start from scratch on things like cloud migration and so on. And I think health is one of these areas that is as well kind of like becomes more and more relevant, because it's probably the sector that is still, especially like in Germany or some EU countries, it's just like a swamp of old stuff with the CDs and all systems and fax machines, like in Germany, etc. And that's this lots of things to do there, right? For DevOps engineers and cloud experts and so on.
Yeah, like when I was actually super curious to jump on your podcast as a guest, because I believe that we totally underappreciate or totally undervalue how much DevOps could leverage generally the landscape of health tech, not only in Germany but across the whole like globe. And I will just frame a question, like it's just out of curiosity, because like we framed the topic DevOps when we started to move from the bare metal into cloud, and for some reason we totally skipped that step when it comes to sharing health tech data, personal health data. The data became remain on premises. That's why if I try to quickly describe the landscape of generally like data availability in health tech, it's not existing. Like I'm doing this funny test when I'm doing customer discovery. I'm asking like, do you know your blood type? 10% of people might know that by chance because they were curious, or I don't know, something happened. But if you say them, where is your, like, I don't know, the last time you were doing the x-ray of your lungs, we have to do it at least once in life. No one knows where it's stored. No one knows like where the data belongs. And the answer is simple. First of all, when digital infrastructure was created, it was not designed for sharing. So there was a format established to share patient data, and generally in the world it's called HL7, but it's been done in the pre-internet time. So therefore, if you start working with any hospitals, the very first question you say, how do we connect with you? And it instantly puzzles people, like, oh, I don't know, like talk to my IT guy. And it turns out like, this, I call it like this Russian matryoshka problem, that it's managed by someone else. And at the end, you are limited to, I don't know, using something like a FTP or SFTP. And if you mention API, it's basically like the words that they know from day-to-day operations, but they don't use in practice. And I think, there is if non-DevOps, then who else is going to revolutionize and turn it upside down? So I'm really bullish on this topic right now.
I have the most recent example, basically, of what you just described, because I had to move from one country to another, And prior to moving, I visited my clinic where I had a number of surgeries and so on. And the thing is, when you go and you need to prepare to another procedure, they give you this checklist of the thing that you need to do before that. And the some procedures I did like a few months ago, and they do not have this information like a checkbox that okay, this guy did this like long screening X-ray, because you shouldn't do this more often than once in a 4-6 months because of radiation and whatnot. And they still required me to do that, even though I did that, and I had to explain to them that no, I'm not going to do that. You already have this info, and they hadn't, and I had to find an actual physical copy of this X-ray and bring it to them so that they could count it. And after that, I was preparing to move from the country to another country, and what I did, I actually took the photographs of all the prescriptions, all the things that doctors gave me throughout the year in order to store it in digital format some way or another to be able to apply whenever I need a doctor here, and to be able to demonstrate them my history of my health. And that's and this is where I was realizing, okay, we do not have this digitalized story. And the most I don't know, like sad part for that is that we have digitalized everything on social media. I don't know, we put everything on online except of our health data and our health history.
Yeah, and I think there is a historical reason for this as well. And well, first of all, to make one step back, what you mentioned in Germany, it's called elektronische Patientenakte, or your digital health history. And until 2021, there was not even a law allowing you to share this data. So right now we have a law that at least empowers you to store this data, but there's no way you get this data out of any source. So it's like, we have a law, but no implementation. But at least the framework is prepared. But answering or digging deeper, why until now, although we share this information in social media, it's very easy to even track your location by looking at your Google Map movements if you have Google Maps installed. But there was nothing done by big tech to store your medical data, although there was a few attempts. I think because the health tech made a huge mistake in the 60s. We outsource our health to insurances. When I'm saying outsourced, it means the services are still performed and done by doctors, and generally the performance of the medical trade, but the billing, or basically reimbursement of services, are done by insurances. So basically, this governmental act where you leverage finance for your health. And imagine if we're going to create a system where this data is stored, who is going to be owed? So right now it stays with the doctor, individual doctor, and you. Well, you don't have access, but the doctor holds it somewhere. And at least it works if you go to your dentist and you're able to track your feelings and all the work. But like, there was ideas before, okay, let's basically gather this data and make it publicly accessible. But there was a lot of thoughts. If you centralize this storage and give it to insurers, because basically, if they are paying for your medical services, they entitled to have this data. And if this would happen, we would instantly kind of create a case where the money will start profiling you, how healthy you are, therefore calculating, if you're entitled to some health services or not. So that would kill our society. Therefore, this will never happen. And this is also the reason why the big tech is also not entitled to have this data. So there is a transparency trust issue. However, the problem is still there. So right now there is a huge vacuum on the market for user-centric app to basically be able to aggregate this medical data, but only stays with the patient. And until now, nobody actually filled that gap. So I'm curious, while you exploring different opportunities, if anyone like me or anyone else was talking about this problem, or at least try to solve that.
I have a funny. Okay, it's not funny. It's like a more like frustrating story about what you said about insurances, because I usually go to one particular, like a skin doctor here in Munich for the regular checks, and then 1 month ago I had to go to another one because I had like appointment today and not in a month, as I usually go to my normal doctor. And then I tried to explain to the guy what kind of previous treatments I had and what kind of previous like prescriptions, and only source of information I had was mobile app from my insurance, because that's where I have all the scans of all the like recipes and the conclusions from the other doctor. There was like basically no other way for me to get this information, like right here or right there at the doctor in the digital way, except just going through this app. The alternative is that this new doctor requests this information from the other doctor, and then I'm waiting for like 1 week till the paper mail arrives or something like this.
But the idea, as far as I can understand, Sergiej, is that to have a global application that is getting all the information that you're every time that you go to whatever doctor, and you're able to put all this information in the same place. So I have to understand something like a standard, no? Some kind of every doctor, every place in the world is able to accept this standard, this unification model. And then even if you go, imagine, to New York, or you go to a doctor in Berlin, or you go to a doctor in Johannesburg, is going to be able to inject data in your record, no? Because if we don't do it this way, at the end it's going to be something like a little pieces, no? Because if you have an application in Germany and then you have another application because of the regulation, a different application in Italy, and because of the regulation, different application in different countries, you're going to end with multiple subsets of your own history, no?
Where are you from, Pablo?
I'm from Spain.
So you, before, like let's travel back to 100 years ago. If I would move to Spain, the only way for me to explain my current condition without speaking Spanish is to save my diagnosis in Latin, because back then the code was already created. So theoretically, we have universal language to describe the diagnosis, and on top of that, every disease out there has a specific code, like it's an international code for each disease. And it's been actually done for billing purposes, again, not for the medical purposes, but for financial purposes, for reimbursement. And if I just explore your thoughts or your question, I would love to imagine a user-centric app where you could just dump or drop any kind of medical data related to yourself. So I envision this as a Dropbox, where you just throw anything. It could be an image, it could be an audio file, video file, whatever. And then at the end, we should find a way to basically process this, store it, and leverage this with existing AI to actually drive readability on observability, what is happening with you. Because right now, if I would share my blood results with you, and you would share your blood results with me, we would see a lot of similarities, but we wouldn't understand. Like we wouldn't know, like, is it good or not? Like, there is always like a threshold in medicine. And I think it's ridiculously simple to imagine this, but so far I haven't seen any practical solution. So I wonder why, or when it's going to come.
Yes, but imagine, for example, that you're a famous person, politician, and then you have an STD, a sexual transmission disease. And no, but it's something that could happen to wherever. And then you have all the record in a database, and some hacker get this information. So then this information is publicly in whatever newspaper. And And imagine that for whatever reason, the wife of this politician is sick in the hospital for the last 3 or 4 months. And do you know what I mean? I tried to put a really strange case. And then everyone is going to know that this guy had sex with another person. So at the end, this information is super sensitive for many people. And I have to admit that many people, they don't want to share the information in any kind of application. They prefer to have in a paper that they can break at home if in that cell, I have to admit that this is one of the reasons.
It is sensitive information, true, but I believe there are companies, there are clinics who already store the information about STDs of celebrities. because they talk to doctors and they still have to store this kind of information, and the thing is we just don't know the facilities that they are working with. And I believe there are already attempts to discover this information and to try to leak it. The thing is it's kind of we know how to protect sensitive data because we already have insurance data to store, banking data to store, and we know how to protect it. And other kind of different important things to store. But for some reason, we think that health information is more important and is more how to say it's more dangerous to share or expose than our financial data. I think it's the same.
I love this. I love this story that happens 3 months ago. You guys know you've heard about 23andMe. So the company founded by a wife of Sergey Brin, also founder of Google. So like big names.
Yeah, and we discussed this case like several times already.
And like I've been also discussing that we some technical talks, and I was thinking, my data was hacked. Okay, there is like a place where 7 million cases are stored now by some hackers, and I would even pay them extra money if they could create a service. They could benchmark my data versus 7 other million to compare me, like what kind of disease I might have, what kind of stuff because normally in the 23andMe, I only have like limited exposure to data. And I would love to even share more, but just provide me with observability on my own health. I mean, like it's generally like, interesting topics. How much are we willing to share if this would give us some insights that like, really meaning to you, like, to...
Yes, what you are talking about, like this is very important because like I like listening different science pop podcasts and videos, and they love to talk about how health science works. And one of the biggest problems is that there are difficult to create like a health breakthrough because how limited access scientists have to actual data. And if we create this kind of system where we can put our the data about our diseases, the prescriptions that we use it, and the date, like if it helped, if it didn't help, and this data will become available to the scientist. They will be able to create and I don't know, and you put an artificial intelligence on top of that, and you will be able to inspect different cases, investigate different cases from different nations, from different part of the world, how one kind of medicine helps to different types of people, and maybe this will create a breakthrough just from being able to access this amount of data. I think this would be cool, but I suggest like let's have our time for brainstorming how this kind of database could be organized, who could be responsible for creating that, because what we already have we already have health insurances who has this data. We already have World Health Organization who can possibly be responsible for creating this database, and we already have international classification of diseases that is used by all the developed countries. And if you have one disease, it means the same in another country. So we have like 3 components, and we could just mesh it together.
Do you think your project infrastructure is well set and maintained? We know for sure there is always room for improvement. If you are uncertain where to begin, let's first do an audit of what you already have. We will review your setup from every angle: performance, cost, security, high availability, and automation, and provide you with a detailed roadmap of which direction your infrastructure should go, generate concrete tasks for you to implement, or even take on your infra entirely, if you let us, of course.
Yeah, we could like for the sake of having fun, because I believe that every day we need to have more fun in what we do. Let's just basically create a startup right now, like, with all the key competencies we have. So Kirill is a renowned AI specialist, mathematician, and a physicist. He knows everything inside out. Pablo was born to design databases. He looks like a database architect. And Leo, you look like a hell of a marketing guy.
I am.
So theoretically, we could combine the resources and create digital twin. So this is an idea that we're working at Caspar Health in the prototypes to actually leverage user data to run predictability, to say that, oh, look, based on your samples and data we have, you might develop the diabetes in 3 years. To reduce that, we need to change this and this parameters, and you have to constantly work toward increase of your basically therapeutical output. And the inputs, this is what we're missing. We're missing a lot of inputs because the inputs are stored in whatever, like every time you do the blood test is there, and then you could get it. So theoretically, we need to have an interface where we could dump all kind of resources. So now the question to Pablo, what kind of database should we take? Relational, non-relational, or we can combine them all? Because at the end, we need to dump everything so that Kirill could have a holistic approach to get this data and train already existing resources with AI to run predictability for us. So this is, for me, kind of an ideation. We could participate and throw crazy ideas here.
The bad thing is that I am not a database guy, but okay, we can continue here.
I coined the term just for having fun,
It was a good try, but okay, we can continue. I can imagine my role here in this.
We could change roles, like
No problem.
I already kind of know one of the examples where they created similar databases is banking, because you have money transactions between different countries, and no matter which bank you came in and you are transferring money, anyone who's doing this from the lowest level personnel to the top tier bankers, we all use the same type of data. We put the same numbers into the same fields in Argentina and USA and in Great Britain. The same numbers, the same fields. We already have the standardization, and the whole world agreed to use this. So we have like a good example. We already know how to do that. The only thing we are missing is a greater will to do that. Do you think this is related to money? I don't know, because this, I think, like from what we are discussing, this is not just a technical problem, right? Because you and I, if we join our forces, 4 of us, we build a new startup. We create the infrastructure. We will create a well-designed database and how to operate this. But we will be limited with the audience who can use this database. And after that, after we create that, we will have to get from one clinic to another for them to agree to use our database. Or we should go directly to World Health Organization and ask them, let's use this because this is where all the money, this is where you can dominate the world.
Yeah, I love how you coin it with, there could be bottom up or top down. And with the challenges with top down, that you never get things done, actually, because that's the issues with who owes that. And there is going to be endless battle between regulators and the hospitals or insurers. So therefore, the legislation is already there that we as users, we empowered to hold, aggregate, and process our data. The problem is that we don't have a solution. So I believe, and every hospital, every organization in the world, they would love to use some kind of, so let's call it wallet, where you could enable this kind of wallet infrastructure for people to aggregate, share, store their health data. And I use the word wallet because you came from financial world, and finances, everything was already kind of regulated. In health, we still at this age of only waking up.
I have to imagine that this example of this startup, because we want to find a way to solve the problem with whatever illness, whatever. I think that is maybe simple if you anonymize all the data. For example, you go to one hospital and you said, okay, there are 200 people every day with diabetes. We don't know the name of the people. I'm going to give you raw data. And this is the data, and this is what we do. But okay, maybe in this case could be that there is a regulation that is able to offer this data in case that there is a study, in case that there will be something beneficial for the global, no something for a company who wants to make money. And I am not against to make money at all. So only that I have to understand that maybe the regulation could be like that. For example, there is a case here now in Spain that is now super famous. It's a company who is making iris scan. So they go to universities, they go to many places with young people, and they tell to them, I pay to you 2K, 3K, 10K, depends of the case. Nobody know why, but they are doing that. And they already made something like 30,000 or 40,000 eyes scan to people. And they have all this data. And then the problem is that, I don't know, but imagine in 5 years that this is the key to open the door of your house. Or imagine that this is... So we are moving to an area that at the end is sensitive data for these people. And they're selling the data because they don't know why this data is so important. So I have to imagine that maybe the people who has diabetes, maybe some guy, they don't want to say, okay, I have diabetes, so you can get all my data. Maybe there will be a lot of people. For example, in my case, if this is for a study, I say, okay, take my data, I have no problem at all of that. But it's something so sensitive, because imagine with this GDPR that you cannot send an email to a person. And if you send an email to a person, they can kill you, because, okay, I sent you an email when you're telling to me, let's talk. So what I mean is that this is not so simple at the end. There are so many regulations, and our startup, with me as a database guy, and with this idea, I think it's going to be a fail.
You're taking a lot of responsibility, probably, yeah.
Yes.
But just, I just want to angle what you mentioned from the different perspective. So let's agree that the data is belongs to the user. So only user is able to share it with anyone he wants. So it's decentralized, some kind of like I'd like to use analogy of blockchain. So the difference why the Bitcoin became so popular versus Visa and MasterCard, because it's decentralized. It offers totally different approach. The same thing with health. Like if there would be an app that able to access your data regardless of regulations, regardless of format across the globe, but it would be only with you, and you got to be able to share it with every doctor you go, like similar to Kirill. If he's visiting doctor in Berlin or in München, he doesn't have to chase for the history what was happening with him before. He has it in his app. He has a history, photos, diagnosis, treatments, what he was taking. It just goes with convenience, because I believe also anything we need to introduce to the public, if it doesn't have a layer of convenience, it will never be adopted.
I think that the key here is what you said, centralize. If you're making something like a blockchain, something like it's not centralized in a database of a huge company who has all the data of all the people, I think this could work. Something that is not like that maybe could work. But if you're telling that this data belongs to a company X and this, you need to pay 10 euros of subscription every month, something like that, maybe this is where is the...
I think in terms of technology, there is a big difference between the finance and the health stuff, because in finance you kind of have to keep this data in multiple places, right? Because you have a transaction between two parties, so it's not something that belongs only to you, it's also something that belongs to the payment processing system. And the example that Pablo gave before with the STD, there's a much simpler example. There was a movie called Middleman about how first online payments appeared around one company that was selling porn online in some different, like they created online transaction description that were hiding what transaction was for, but then in the end the owners of the companies, they were able to blackmail politicians because they knew all the transaction history. And we kind of are okay with this now, because in the end every single transaction you make in the bank, it's stored somewhere out there and it can be used against you in many, many different ways without you conducting STD, right? But in case of health, we actually can do what Sergiej is telling about, that we can have completely decentralized system where all of this is stored on the hardware device which is owned by you, and maybe like upload it fully encrypted to the cloud, that the cloud provider can access it. And then you just need some kind of like other devices that can basically read it from your hardware devices, the medical data, to make the access easier.
Yeah, because at some point my doctor would want to get access to it without me. For example, he's researching something and he sends me, for example, he tries to access the data and I receive a notification. This doctor is trying to access your data. Would you like to share it? I click yes, I agree. And he gets access, something like that.
Which is not different from what Sergiej said about Dropbox, right? Because in the end, Dropbox is this thing that I have shitload of private information in my Dropbox account, but I kind of trust that Dropbox hopefully does not have like direct access to the data that stores there. It's all encrypted. I can share the data with anyone I want if I want to, and I have the convenience of having all of my like scans, notes, whatever else I store there all over the globe. And if you can have something like this for the medical data, I think that would be amazing. But
when you mentioned this ability to lock your personal data to storage that stays on a device, and then it could be, you could sync it once in a while that you have a backup. I was watching a Netflix movie. It's called Altered Carbon. I don't know if you've seen this. It basically describes the future where people are able to download their personality mind, so basically their ego, to like a small chip that this holds in your part of your brain. And then the body is called sleeve. So basically the body becomes irrelevant anymore, because everything that we consider ego could be kind of downloaded on your device. And funny how we coin it, like right now in Caspar Health, I'm working on this concept of enabling our app to store this data and constantly enhance your profile by adding more stuff, and we call it digital twin. So basically, in fact, it is already an ability of human to create digital self or avatar that consists of track record of medical information. And now I would love to just throw a ball in your direction. So do you actually believe that what we discuss and what Kirill mentioned, imagine we have a super simple mobile app that stores the data, but then syncs once in a while, but the storage kind of like, limited to only one device, but you could kind of like retrieve it and stays only with you. We don't need to use a term blockchain, but from everything we have until now in terms of technology, is it possible?
I think technology-wise, absolutely, because we have like image recognition, right? It's out there since a while, and became more powerful in the last years. Video recognition, the analysis of any kind of sensor data. Like if you look at sensor data from the car and sensor data from your body, it's different data, but in the end, the principles underlying this are the same. And I love to collect data about myself a lot, and I store it in different digital formats. And I think actually what, for example, Apple is doing with the Apple Health is pretty good, because they collect as much as they can within like legal constraints, like the heart data. With the heart sensor, they collect the movement. Like if you are moving a bit like in the wrong way, they will tell you that you're like 2% off. And they give you the analysis and predictions of like in the last 3 months, the trend for your resting heart rate is worse. So it's like these base metrics are already there. But the problem is, I think it's not about technology or having technology to do this, because our smartphones are extremely powerful now to even do on-device AI and all of these things. It's about who owns the data and how to access it. And today, if you like what you said, Sergej, is that this digital patient card in Germany is since 2021, right? So it means if I try to do a startup like this in 2020 or 2019, there is simply no legal regulation for me to implement this. So my startup dies at the concept phase because I cannot do anything.
Correct. Right now, I mean, like we've already established the concept. So 4 of us, we're already working on this fresh idea. So we still might die pretty much soon, because we still need to break through the convenience of convincing people that what we have is safe. But, I simply believe that we are around the corner of big discovery. And if this will not going to be coming from Apple, which I would be very cautious sharing my data, because I believe simply independence, it needs to stay with the user. And I wonder, Kirill, would you pay for this kind of app if you would have some kind of like a power of Apple data aggregation, but fully independent?
I personally would prefer that, because I think when it comes to health industry in general, I think mixing health and money is extremely toxic combination, because it just ends up. And there are like so many examples, right? There were, if you just take smartphones, there was, for example, 2 or 3 years ago, the case that there is an application to track periods, ovulation for the women. And the app was free, and what was discovered for sure that all this data was going to advertisers. And then it was used to push products related to periods to these women.
Crazy shit.
So as long as you involve the finance part into health in general, into AI with health, into storing data, it just goes sideways. Insurances will use this against you, because they will see, okay, your data like for blood pressure is kind of shaking last 6 months, so we will increase your monthly premium. Or employees can see, like in Germany, you cannot refuse to hire a woman if she's pregnant, right? It's against the law. And then she doesn't have to disclose these kind of things when applying for the job. But with this kind of system, if this data is kind of in this commercial space, the companies can in theory obtain it and then not hire someone and go prove that they have this data.
Exactly. Or like you have a risk of having cancer. I don't know, like all men by default, we have a risk of having prostate cancer after 50. So if you, for some markers, it will, you have a higher risk, people will also never hire you, because why would you have like, sick employee? But yeah, I'm really curious, like if it might like we've already came to a conclusion that if the data is centralized, people probably will be willing to even pay for this out of their own pocket. Out of curiosity, who of you have visit medicine privately and pay for it privately, although you have insurance?
I did that.
I think everyone, in case that they have a big problem, no, is doing that. Or in case that there is living in an island and there is not this kind of doctor, and then with your insurance.
Because I have access to doctors, and I've been asking this question, like, do people start changing their habits because you have insurance, but you have to wait 3, 4, 6 months until you have a treatment. So people say, damn, I'm going to pay out of my pocket, but I get like a premium service. And I see this readiness in society is already there, because although we kind of like outsource finances for the medical treatment to insurances, they screw it totally. people call it like, public medicine, but the quality of medicine in Germany is really, really bad.
Yeah, and in case of Germany, we should not probably go too deep into it, but there is this two systems, like public and private insurance. I'm personally private since many years, just because of what you're telling is that I just don't get enough preventive medicine and checks in the public system that private covers. Because then private has also its disadvantages, and that's against nothing with technology. It's the system, medical system that differs country to country and how it's implemented, and the cost of services. I think more people would be happy, for example, to do regular checkups if that would not cost like up to 2-3K per year for a private person if you're just paying from your own pocket.
Yeah, what I would love to also, raise as a concern, the general medicine, like in the world, works in the, post, not the prevention. We act as a interventive medicine. So once something happened, you go, you do the analysis, and then the treatment is prescribed to you. And everyone is questioning this, saying, if we actually think as Kirill, where you believe that, okay, if I do the pre-checks regularly, maybe the disease or the issue will never happen because I could prevent this. And the generally overall cost for health is going to be a lot cheaper for the society. But because it is in the hands of insurance companies or pharmaceutical, they're not incentivized to turn the table and make it preventive. And this is why I also believe that our solution that we just designed with this Dropbox for health data could actually change that. Because if you constantly do the pre-checks before something happened, you could all see like, offset in your trend data.
I was wondering from a technical point of view, how difficult would it be to create this decentralized system that the users like us would love to start using without, like, we do not create a database that where one company owns the data. We create a system for users to start using it, and they come to doctor, they have their prescriptions, they have their diagnosis, and they ask them, could you please store it in this particular format for me? And doctor says, oh, okay, that's no problem for me, just give me. And the doctor doesn't need to have something installed or applied. He just passes all the data to the users in the format that it's convenient to the user. And the user is responsible to store it and to save it. And once all the users, all the people start more and more start using this and start asking their doctors to pass the information to them in this particular format, and that's where the company and the regulators would love and would want to join in, to be able to improve and to I don't want to say monetize on this information, but some of them would certainly would. So the question: how hard would it be to create such system and maintain its security and reliability without creating like a database as is, so that someone like us, four of us, have direct access to all the users' data?
I don't know who could answer this question. I could tell you that what problems we faced while building an MVP. So the first, as you described, the challenge we had is basically to what kind of database to have to handle all kind of non-relational formats. So because for some it's an image,
yes,
for some it's basically the text file. For some, because like when I was doing the user discovery, people say, "Look, I would love to just take a audio clip and tell how I feel." I've taken this prescribed medicine and I feel dizzy, so I need to then probably store it in an audio to text format and still have it stored somewhere. For others, it's maybe this MR, like what is it called? This, like, X-ray, but MRT, like like the specific
MRA.
format of images that you MRA. Yeah, you need to store it. So there was the first challenge, and then the second challenge was how to retrieve this data for aggregation and analytics. So already those two first steps, I was thinking, it's very interesting challenge.
With power of AI, I assume okay, so you have a picture, a list with you did a blood test and they print it for you on a paper. You just take a photo of this, and you take a photo of the text that your doctor wrote to you with all the prescription, and I don't know, some image recognition with powered by AI parses the image, and this recognizes the test results, and it stores in the format that we created. And no matter in which format the results were giving to the patient, the AI will be able to recognize it and to store it. For example, like your blood type, like they put it in a different way, in a different place on the paper, but the AI and the image recognition will be able to parse it and find your blood type from the image and store it. And same is for the text, and same is for the name of the medicine. It will be able to collect, and then you just take pictures of anything that your doctor gives to you, and it's stored inside the database. I think this is like the most convenient way for the users to start using that, because all they need is their smartphone and internet access.
Yeah, like I have an instant follow-up question. Do we agree that every data could be stored in a text format? Like, because theoretically you parse everything, then you convert it to any format. So then at the end, if it's machine processes 0 and 1, right? But I know it's possible, but it's very hard for me to basically, conceptualize that, how this could look as a solution. Like, I just imagine that Kirill created this super easy app, and he's dumping his data right in. So there is a video, there is image, there is a text, there is anything else. So in a way, it is there in his Dropbox, but then to empower this data to be applied for observability and predictions, there has to be a model that understands what's happening, that this specific data is a blood type and the other one is X-ray of his lung, and the other one is, I don't know, like the DNA test that's taken from the hair. So although the solution seems to be beautiful and simple, but underlying issues are complex. So we need to bring another guy into discussion.
Okay, there is a famous joke. How do you eat an elephant? Yeah. So the answer is piece by piece, which means it's worth taking a step-by-step approach to solving problems. And I think that if you start with MVP, minimum viable product, I think I would be more than happy with the minimum possible functionality where I just don't have to store all my prescriptions, all my diagnoses in a piece of paper, but I can scan all of those and specify in what format I store them, and at least categorize them to start with, and then, if necessary, pass them to another doctor. Let's start at least with something like that.
I have a follow-up question about data in general to you, Sergey. In regards to digital twin, do you see any, what's the level of standardization around this data in general? Because I have to imagine when you do an MRI scan in a Siemens device, the output, the final data, which is not an image and it's not a video, is kind of this special format that allows you to kind of scroll through and look at different angles. And I have to imagine that Siemens output would be different from, let's say, something like Samsung, because they also make medical devices for the ultrasound, for example, and for MRI. Is it standardized already? Because I see it's a big issue. Like, you can collect all the data, but as long as every manufacturer and every laboratory gives you even the blood data in different formats.
Yeah, unfortunately, it's not. So basically, the example with X-rays and MRIs, although the outcome is the same. So at the end of the day, doctors see the image, but output in terms of format is different. And already now, if you would go to your doctor and do the X-ray or MRI, you would get a CD. So basically, they've skipped. Well, they not the skip. They didn't follow up with this step of digitalization, where when this technology was developed, we were in the CD layers. So you're stuck with CD, then you have to take this CD, go to doctor, and pray and hope that your orthopedic practice will have the CD reader. This is what happened to me several times. They didn't have it, and it was like, back and forth until we found somebody who would have a CD. But there is no other standards. In Germany, you would operate with the output of CD. So the format is one question, and already basically the way we operate right now with hospitals, I think we are connected to 300 hospitals. There is no standardized format. So there is like a stream of text data, which we would love to receive in the JSON format. The JSON format hasn't been introduced, so they still operate on this Java XML standards, but it's still, at least you have some kind of relational data, so you're able to parse it and map it to what it should look like. But this is only with textual data, so everything that could be described as a text. With images, normally it's shared as an image format, so you get one-to-one relation to image, and then you see how to convert it into format that you want. And we only touched text and images, but there is the whole world of other stuff. Like, I don't know, if you do some more precise blood tests, you would get understanding of your peptides or proteins, and they are this it's slightly different chemical format. This format of the organic chemistry we had. I don't know if you remember this, string of the composition of what you have in your blood, or what does it consist of. But before we even before we solve that, I always start with asking a question. When I go and I see the patients, and I would say, hey, do you believe there is a problem? And they say yes. Would you love to share your data? Yes, go ahead, take my data, because they all have some kind of issues. They willingly they have a will to share this data if we're able to provide them some kind of help. And I'm over optimistic that if these first two steps are answered, problem and willingness to solve it, then the third one will come. It's only a matter of time and right enthusiasm.
Okay, it's just beautiful. That already sounds promising, and I'm very encouraged that the industry has talents like us, and that we are here today to discuss how we are going to redefine the healthcare landscape. Something that should have been done a long time ago, but for those who, like us, are wondering the same things, Sergey, where and how can they learn more about you and get to know what you are doing?
Yeah, I'm going to share my my podcast link and also my personal profile link, so we could put it in the description. But generally, I would love to challenge your community of DevOps engineer practitioners, experts, to engage in these topics, because this is the right time, the right opportunity, and the right people, I guess.
I totally agree. You who are listening to us today, join us, subscribe to Sergey and his LinkedIn, and I will make sure that all the links will be in the description down below at the bottom below the video. And also be sure to leave us your comments about your experience with digitalization of healthcare and how you see the future in this area. And of course, subscribe to our channel so you don't miss the next episode of DevOps Accents in 2 weeks. Thanks for being with us. And to you, Sergey, thank you so much for joining us today with Pablo and Kirill. It was unforgettable. Until then, goodbye.
Thanks a lot.
Thank you, Sergey.
Thank you.
The cloud tech industry is evolving so fast. Do you keep up with it by improving your skills or upskilling your team? At MKDev, we offer a variety of workshops for just that, from the basics to expert knowledge. Before delivering our workshops and training sessions, we carry out a detailed assessment of each participant. To make sure the workshop is helpful for you and your team, we will add more content to it or throw out what you already know. Or we create a custom workshop specifically for the needs of your team and the specifics of your project.